the propagated myth across the globe is we have done the transplant and medicine we are giving just to sustain your existing hair.
One of our patients, you must remember, he was a doctor himself. So he met with another doctor for his hair transplant, a doctor who is known to treat many celebrities because they keep on showing it on their social media. So he went there and he was suggested like 3,500 to 4,000 grafts plus full dose of medicine. But this doctor couldn't get his hair transplant done for some reason, but he had started the medicine. And at 4 months, he had like such good results that he thought, why was I even considering a hair transplant if the medicine can give such good results? But then he started having some side effects of the medicine, and then he came to us, and then we discussed about the results of medicine, the results of transplant, and how we were able to decrease the dose of medicine and give him some transplant to give him the similar coverage.
So the problem, before coming to us, he went to the clinic also who suggested that grafts and the medicine. So he asked that clinic, were you going to put those 3,500, 4,000 grafts? There is not even a space to put a small dot there because hair growth was so dense. And he thought, were you going to cheat me or in case you were still going to implant 3,500 to 4,000 grafts, won't it be a wastage of my grafts? Why? And now since I'm having the side effects, so why didn't you give me option of microdosing also? So there are studies. He was a doctor himself. He read about it. He saw that smaller doses can also help to prevent further thinning. But the common belief, the propagated myth across the globe is we have done the transplant and medicine we are giving just to sustain your existing hair. Now this is the perception which common man has universally in Europe, in US, on Reddit, on forums, everywhere. And it is the case. And they think that it is very simple just to have the medicine and it is just to sustain the hair. And no doctor wants to acknowledge even that yes, this medicine is doing more than 80% of my job and I'm just doing 20% of the job. And that too, not just the coverage, not just the density, the most critical part, which is hairline designing, where the clinic actually goes and pays 20 lakh for a hair transplant versus he's paying 20,000 in some other clinic. Why? Because at the 20 lakh clinic is showing him hairline which looks natural, which is undetectable, and 20,000 clinic hairline is not that good. So it is the most critical part of hair transplant based on which patients take their decision to go for one clinic, to choose a clinic. But the problem here is even that hairline, which the 20 lakh clinic is showing, could be looking much better than what it actually is because of full doses of medicine.